All right, guys, this is a super exciting day for me. After many, many years of running a practice alone and kind of getting this baby off the ground and creating a style and a brand that I was so proud of and every day become more and more proud of, it was time to expand. Well, we have a lot of patients, so we have a lot of people that come to us from all over the world and all over the United States. To do that is not easy. To do that, you have to find similar-minded people. And if you go to 10 surgeons for the same treatment, you're going to get 10 different answers. It's very rare to find somebody who has the same philosophy, the same attention to detail, the same style, and the same care for the patients. So I searched, and I searched, and I searched. The initial time I started searching was 2021. And then I had to move to New York, and we expanded the practice here. And then I started searching again about a year ago. You guys are involved in that whole process. You've seen my posts. But here's the good news. I have finally found someone that is at the top of their game, is somebody who has style, who has compassion, who has beyond the excellent technique, has the results to stand behind, and has the reputation that is global in our academy, in the American Academy of Facial Plastic Surgery. And today I want to introduce her to you guys. I'm super excited. Please meet my colleague and the newest addition to the Salon Facial Plastic Surgery family, Dr. Nigar Ahmedli. I'm so excited that you're here. I'm so excited to sit down with you. It's been months that we've been talking back and forth, trying to evaluate each other and trying to see if this is truly a match. And I am so excited to know that it is. We have had conversation after conversation after conversation. How does it feel to leave academia and come here?
Well, thank you so much for that welcome, because it really means so much for me to be here. It's almost a little surreal, like it's not really happening. When we first started talking, almost the first time I met you was about a year ago. You were this sort of otherworldly character to me, someone that I really respected, but almost unattainable in a way. Like, you were so amazing. And so for me to be here today talking to you and joining this practice and being part of your team is literally breathtaking. So I'm so excited to be part of this journey.
I appreciate that. That's really nice. And I'm so excited to have you here. I want to talk to you directly about style and what that means to you, because it's a big part of our practice. And we've chatted about this before, because you can perform a surgery technically flawlessly and the result not be all that pretty. I'm sure you've seen that around. What are your thoughts on that?
In my training, one of my fellowship directors told me that you either have the eye or you don't. And you can perform something, as you said, technically flawlessly, and there's just some mismatch. There's that pretty or delicate or subtle that you can't touch if you don't see it. And I think that's really what it comes down to. It's not just about the 1 through 10 steps. It's about how you align it for that face, how you make that individual's characteristics pop by doing one maneuver or one manipulation. And I think that's something you can't explain. And I think the people who are really successful in our field have that something that you don't just learn.
And style you do have, there's no question about it. I mean, you've trained with some of the most amazing pioneers in our field. You've trained at some of the top institutions in this country, which also means the world. And it's fascinating to see all of that. I've seen your papers, I've looked at your CV. It's just mind-blowing, all the things you've written. You're very involved in rhinoplasty. You're a rhinoplasty expert, a facelift expert. And we've talked about the different styles of facelift, and I'll leave that out for now. But this is your baby. And in addition to that, we've spoken about your expertise around the eye, with the eyelids, with the brows, and as well as your non-surgical expertise. And that is something that I'm so excited to bring back to this practice. I stopped that about, I think, 3 years ago. And to have that, because not everyone needs surgery, right? There are things that we can do to help patients without necessarily putting them to sleep. How do you balance surgical and non-surgical practice in your style of worldview?
I think it's a discussion. It's a discussion between me and my patient. It's the result that they're trying to achieve and what they desire and what I can do to help deliver that. And sometimes, yes, it's surgery. Sometimes it's definitely not surgery. And sometimes it's a combination of the two. To be an expert is to determine what combination and what proportion of combination, right? And so it's not just a simple algorithm that if you have this trait or characteristic, I do this. No, it's about analysis both of the face of the patient's desires and what they can handle, both physically, mentally, emotionally, everything. And so that's sort of how I look at it. It's a whole process. It's not a simple thing.
100%. I get that a lot with this, the buccal fat removal. You know, people say, oh, no, we cannot do that. Or yes, we should do that. And 5 years ago, you remember everybody was getting their buccal fat removed. And, you know, I think plastic surgery is big part art, you know, and I know that, you know, some put more art and some focus more on science. I think it's such a blend. You cannot separate the two, because for me, plastic surgery is not about beauty. It's about alignment. It's about aligning how you feel with how you look.
Yeah.
And it's not about trends. It's not about, right? And it comes down to, yesterday I had a patient that came in and she had had surgery elsewhere, and she came in, she had a little dent here, and she was told that she needs to have surgery, a revision. And we resolved that problem with a simple injection, and she might need to come back for another injection or whatnot, but that's it. You know, sometimes easy wins. What is your view on aesthetics that are timeless versus all the trends that people come and ask for?
I have a really negative opinion about trends because trends are a fad. Trends are on TikTok and popular, and and people get stuck on them. But what's good for your face is not a trend. I think where facial plastic surgery is going and has gone really in the last 5 to 10 years is natural and optimization of the face that you have. It's not to recreate a face. It's not to mimic a face. The example I like to say, it's like we're not incubating little chickens, right? We're not trying to make the same mold over and over. We're trying to make you and your face the most refined or delicate or pretty or whatever you want it to be. It's not to stretch this and morph this and be inorganic.
Absolutely. And we saw that a lot the past few years with the fox eye, with the BBLs, the massive BBLs that now people cannot get rid of. And so, yes, that's the story. I am just so happy and excited that we have the same view. I'm excited to have, and this is what we've been looking for, to have somebody at the highest caliber of our practice. You know, I've trained surgeons and I continue to train surgeons. You do the same. You've been in an academic center. You've been the director of facial plastic surgery at a major academic center in New York City, training residents and fellows. And that's nice. It's very rewarding. But at some point, it's also very nice to know that you're at the top of your field and you're working with someone of the same caliber. So with that, I welcome you to Someone Facial Plastic Surgery. You guys cannot go wrong with whoever you choose in this practice, because we only bring on the best of the best. And so with decision should be based on style. Decision should be based on what grabs you, the connection you have with your doctor. And no matter what, you're going to get the same top level attention to detail that you're used to in this practice. Welcome, Dr. Ahmedli.
Thank you so much. I'm so excited to be here. And thank you so much again for welcoming me.